As we talked in last video, in this video we are going to talk about the medication of diabetes, in which the allopathic one and Ayurvedic. Also the food that you should avoid in diabetes and the food that will be okay with diabetes, and also the exercise that might help you to control your diabetes. So without wasting our time, let's start with the video. I'm your pharmacist friend Shubham. Welcome to my channel Health Library. Before we start with video, I want to share you little more information that I missed in last video, that is how the fat affects the glucose level in the blood. So on the screen you can see the diagram of a cell. Here is the glucose entry. Here is the insulin receptor, where the insulin binds and signals to cells to open the gates for the glucose to enter into the cells, and these are the gates. And when the insulin attached to the receptors, the gate automatically opens for the glucose. And this part you are seeing is the fat, which is like a chewing gum. And when this fat blocks the gateway for the glucose, ultimately the glucose cannot enter into the cells, and hence it remains outside the cells and deposit into the blood, and hence the blood glucose level is increasing. So that was the point I haven't cleared in last video. Let's start with our video now. First class is sulfonylurea. The drugs from this class lowers the blood glucose by increasing the insulin secretion by the pancreatic beta cells, and also may increase the peripheral sensitivity to the insulin. Now, what is peripheral sensitivity to the insulin? If I tell you this in this video, the video will be so long, so I will make another video on this topic. For now, let's see what are the drugs covers in the sulfonylurea group. There is a gluburide, which dose around 2.5 to 10 milligram per day, and the maximum dose for this drug is 20 milligram. This drug should be taken 30 minutes before the meal. This drug can increase the risk of hypoglycemia. Now, hypoglycemia is opposite to the diabetes, that the blood sugar level really goes low. Hypoglycemia, and the glipizide is another drug from this category. The dose for this drug is 2.5 to 20 milligram per day, and 40 milligram per day will be the highest dose. You cannot exceed more than 40 milligram per day. Okay, and this drug also with the risk of hypoglycemia, and it should be taken 30 minutes before the meal. Third drug is glipizide XL. This dose range from 5 to 20 milligram per day. Maximum dose should be 20 milligram per day, and it should take with the first meal of the day. And then the glimepiride, 1 to 4 milligram. Maximum dose should be 8 milligram, and also should take with the first meal of the day. And the both drugs are, this whole category sulfonylurea comes with the risk of hypoglycemia, so I shouldn't telling you it separately for each. And the last one from this is gliclazide. Its maximum dose is 160 milligram per day, and you can take from 40 to 80 milligram per day or twice a day. And it also should be taken with 30 minutes before the meal or the first meal of the day. The second class is medetinide, in which the glinide and netaglinide is the drugs. These drugs stimulate the insulin secretion, rapid onset and emulsion associated with less hypoglycemia. It means these drugs are not in the risk to make you in hypoglycemia, but these drugs are short acting. It works for 2 to 3 hours and it should be taken 30 minutes before the meal. Do not take this drug when you are not eating. Test blood sugar 2 hours after eating to determine the peak effectiveness of dose. The third class is the glitazone. In this class, the pioglitazone and rosiglitazone are the drugs. These drugs reduce the insulin resistance, improve the insulin sensitivity in muscle and adipose tissues. The dose for these drugs is 15 to 30 milligram. Maximum dose should be 40 milligram. 4 mg maximum dose for rosiglitazone and 8 milligram per day is the maximum dose for rosiglitazone. These drugs may be taken with or without the meal. Do not double up the dose if it is missed. This drug can show the side effects such as jaundice, nausea, vomiting, fatigue, abdominal pain, anorexia, or dark urine. If you found with any of these symptoms in you, please contact your physician immediately. Fourth class is bigonides. Bigonides contains drug metformin. You must have heard metformin because it's a famous drug for diabetes. This drug improves the peripheral insulin sensitivity and glucose uptake, decreases the hepatic gluconeogenesis. The dose for this drug is 500 to 850 milligram twice or twice a day, and 1000 milligram for twice a day, and the maximum dose should be 2550 milligram. This drug can cause stomach upset, diarrhea. These symptoms last only a few weeks. Take with food to reduce symptoms, usually no risk for hypoglycemia, not for use in a patient with a liver or kidney disease or CHF. The fifth class is alpha glucoside inhibitors. The drugs are acribose and maglitol. These drugs delays the digestion of carbohydrates, resulting in a smaller rise in a post-meal blood glucose. The acribose should be taken 50 to 200 milligram per day. Maximum dose should be 300 milligram per day. And maglitone is taken 25 to 100 milligram per day, and the maximum dose is 100 milligram. This drug should be taken at every meal with the first bite of the food. This drug may cause gas or bloating. The sixth class is DPP-4 inhibitor. The drugs from this class is sitagliptin and saxagliptin. Sitagliptin should be taken 100 mg daily in one dose, or 50 mg daily for renal failure, 20 mg for ESRD. The saxagliptin. This drug should be used in type 2 diabetes only. Take once a daily at a consistent time. May be taken with or without food. May cause low blood sugar when used in combination with sulfonylurea. Lower dose of the sulfonylurea may be needed. Lower doses are available for those with renal diseases. The seventh class is incretin hormone. In this group, the excitinide and liraglutide are the drugs. Excitinide should be taken 5 mcg, not mcg is lower dose than mg. It means the 0.5 milligram 2 times a day, breakfast and supper, and the maximum dose should be 10 mcg. It means 1 milligram twice a day, breakfast and supper. Okay, supper means the dinner. All right. Then liraglutide should be taken 0.6 milligram daily for 1 week, and the final dose should be 1.2 to 1.8 milligram daily. The this drug is usually or must be used in type 2 diabetes only, not for in those with gastrophageal. Do not use this drug when you have gastroparesis. Given by subcutaneous injection may cause hypoglycemia in a patient taking sulfonylureas. Take 15 to 60 minutes prior to the meal. If does forgotten, do not take after the meal. May cause nausea. If nausea is probably, try to eat within 15 minutes of the injection. Do not take Bitra if blood sugar is low. Bitra is a brand name for excitinide. Then the precautions for liraglutide is take once a day at the same time. Does not need to be timed with meal. Liraglutide should not be used in points with a history of the patients of thyroid and cancer. 8th group is amylin. The drug is pramlintide acetate. This drug suppresses glucagon secretion, slow gastric emptying, reducing food intake. In type 1 diabetes, 2.5 units, that is 15 mcg before major meal. Increase dose by 2.5 units, that is 15 mcg every 3 to 7 days if no nausea, up to maximum dose 10 units, that is 60 mcg. In type 2 diabetes, start with the 10 units, that is 60 mcg before the major meal. Increase dose to the 20 units, that is 120 mcg in 3 to 7 days if no nausea. Indications regarding using pramlintide acetate in type 1 and type 2 diabetes. This drug is not for those with a gastroparesis. With first dose, decrease the usual mealtime insulin dose by 50% to reduce the risk of hypoglycemia. Major meals have at least 30 gram carbohydrate or at least 250 calories. Use standard U100 insulin syringe. Inject in the same manner as insulin. Never mix insulin and pramlintide acetate. Use separate syringe for each. May cause nausea initially, usually subsides after the first few weeks. Do not take pramlintide acetate if blood sugar is too low or when not eating. 9th group is sodium glucose transporter 2, that is SGLT2 inhibitors. The drugs from this class are canagliflozin, dapagliflozin, etc. This drug lowers the blood sugar by causing the kidney to remove sugar from body through the urine. This drug is not approved for type 1 diabetes, it's just for type 2 diabetes. Side effects of these drugs are genitourinary infection, diabetic ketoacidosis, acute kidney injury, risk of amputation, hypotension, that is low blood pressure, and the bone fracture. This was the class of drugs used in diabetes, mostly in diabetes type 2. Now we are going to see some insulins. Those are mostly used in the type 1 diabetes. So let's see it one by one. Now we have classified these insulins on the basis of their action, that is rapid action, short action, immediate action, long action, and combination. So in the first category, which is the rapid action, the insulin needs admilog, that this insulin should be taken via pain and vials. Second is Afrezza inhaled powder. 4, 8 and 12 units cartridge are available in the market. Then Apidra, this also should be taken via vial and the pain. Flaps, this insulin should be taken via vials and pains. Then Humalog EU100, that is unit 100 and U200 should taken by vial, pain and the cartridge refill. And the no log should be taken by vial, pains and cartridge refills. This was the rapid acting. Then the short acting are the regular insulin, should be taken via vial in the pain. Then U500, that is 5x the concentration, should be taken by vial in the pain. And intermediate acting insulins are NPH, created in 1946. They should be taken by vial in the pain. Next category is long acting insulins, in which the Basaglar, Lantus, Livimir, these are the insulin should be taken by vials and the pains. Then Taujio U300 should be taken via pain, and Trisiba U100 and U200 should be taken via pain only. Then the last insulin category is combination, where NPH, that is regular 70/30 should be taken via vial and the pains. Rapid acting 70/30 should be taken by a vial and the pains. Rapid acting 75/25 should be taken by a vial and the pain. And rapid acting 50/50 should be taken by a vial and the pain. Now the Ayurvedics. I'm going to tell you some plants that are useful in the diabetes patient for medications. First is sugar killer, that is Gudmar. This whole plant is used for diabetes medicine purpose. Then the Indian Kino, that is Vijay Sagar. The heartwood of this plant is useful for the medication of diabetes. Then the bitter gourd, that is Karela. The fruit and the seed of this plant is used for the diabetes medication purpose. Then the Ayvai gourd, that is Bimbi. The leaves and the fruit of this plant is used for diabetic medicines. Then the black plum, that is jamun. The leaves, fruit and the seeds of these plants are used for diabetic medications. Then Bengal quinines, that is bale. The leaves of these plants are used for Ayurvedic medication. Then the Morgosa tree, that is neem tree. The leaves and the the seeds of these plants are used in diabetic medication. Then the turmeric, which is haldi. The whole haldi is used for diabetic medication. Then the aula, that is Imblic myrobalan, that is the fruit used in diabetic medication. Then the methi, that is fenugreek. The seeds of methi are used for diabetic medication, and the guduchi, this plant also used in medication of diabetes, and the sharifa, that is sitafal, this is used in diabetic medication. The particularly the leaves of these plants, and the paneer doda, the fruit of this Indian rennet used for diabetic medication, and the sadabahar flowers. The flowers and the leaves of these plants are used in diabetic medication. Now I am going to tell you some famous medicines, Ayurvedic medicines, which are used for the diabetes. That is the Himalayas, Epicondius, then the Yasaka, then Jambaso, and this Madhurakshak, and many more. So this is about the Ayurvedic medication. Now I'm going to tell you the food that you should avoid in the diabetes. All the food with added sugar should be avoided in diabetes. For example, cakes, cookies, pies, Diwali sweets that is gulab jamun, rasmalai, peda, barfi, etc. One more point I want to clear here, that is, for the humans, there is no need of extra sugar to consume out of your food items. Even though you can take 20 grams, that is 6 teaspoons of sugar for the women per day, and for the males, that is 36 milligram, that is 9 teaspoons sugar per day out of your food. But it is better to avoid take sugar other than the food. Beverages with added sugar, that is tea, coffee, cold drinks, prosthetic food, fruit juices, etc. Then the food with saturated fats, that is palm oil, coconut oil, cheese, cake, biscuits, ice creams. Then the alcohol and the ultra processed foods such as ice cream, jelly, cookies, etc. This food should be avoided in diabetes. Food which is okay with diabetes is the beans, broccoli, berries, avocado, popcorn, whole grains, all type of grains, and the apple, dried fruits, nuts, almonds. These foods are okay with diabetes. And the exercise that might help you to control your diabetes, these are the walking, cycling, swimming, aerobics, and the yoga. This exercise might help you to control your diabetes. That's it for today's video, guys. In next video we will be talking about the hypertension, and the hypertension, that is low blood pressure and high blood pressure. The same videos are available in Marathi in my channel Health Library Marathi. I will be providing link in description. I hope you like this video. Comment if you want to ask anything or any suggestion if you have. Share the video and subscribe my channel. Thank you, guys.